What I'll also share is throughout what we'll be doing is we'll have our three speakers. We'll have a chance for some Q&A at the end, and we'll also have a link for a survey for your feedback and an opportunity to, if you're interested in the theme around wanting to learn more about this community of practice moving forward, or even getting some funding for your council areas, there's a special link for a meeting for next week. So without further ado, what I'd like to do is hand it over to Tom Docking. Now, Tom Docking, for those of you who don't know, is the CEO and founder of Dad's Group. But to me, more than that, Tom is someone who is genuinely the most passionate person about supporting fathers that I've ever met. I think when you talk to him about his work and the impact of what he is doing and the involvement of Dad's Group for Australians and people who have families, his eyes always light up, and I always have a good indicator if someone's really passionate about a topic. It's all in the eyes. So a wonderful man, and Tom, I'd like to throw it over to you. Please welcome Tom Docking.
Thanks, Andrew. Thanks, everyone, for joining. It's really exciting to be here today. Something that I know Blair has been working on and the team has been working on for some time now. And really, our passion across our team is doing a better job of supporting new families across Australia. It's focused largely on fathers, not because of any other reason other than the system has overlooked fathers, as you will all know. I'm going to give a bit of a background of where it began, and I'll try and keep it relatively brief, but also quite a bit of how we do what we do and the principles of what we do, and also some of our journey and what we're working towards as a team. My wife Kate's also on this call, and also really the co-founder of Dad's Group, and everything that we've done at Dad's Group is attempting to engage mothers, fathers, and babies and support them in a way that's meaningful to all of us. This first slide here that I'm going to talk to, actually, before I go on, I just want to acknowledge the traditional owners of the lands that I'm dialing in from, which is the Gubbi Gubbi people here in the Sunshine Coast. We acknowledge the elders, past and present. We also acknowledge the babies that have been born on this land and will be born on this land. And as we move on, this slide here reflects over 10 years ago when we first started this work, looking at trying to simplify the challenge in our, in our society, which we saw or I saw quite loudly. And that was, even though my mum was an incredible midwife and won many awards, including an Order of Australia medal for the work she's done across Australia and Africa, in the midwifery space, the system overlooked unintentionally fathers. So we know that many, many, many midwives and child health nurses like yourselves go beyond the scope of your role to support fathers. And we really are grateful for that in the work that we do. And it's because of your work we've been able to do the work that we do, which is advocate for fathers. But this slide is meant to highlight the lived experience of a father. That was my journey in 2014. And that was that, as you can see on the left-hand side, the motherhood experience, whilst it was not complete and whilst it wasn't, it still has a lot of increased needs in that space and increased support requirements. The general sweeping observation is that there is, family and child health, which has come out of a maternal centric model. There's council supported mothers groups, there's mothers community programs, and nationally and in most communities, there was nothing for fathers. And the likely outcomes there outline that there's educational professional support for mums, years of healthy community experience through those mothers groups, which we often hear of mums groups who, I think even Sam, who's speaking later, is still connected to some of the mums from her mothers group. And so many times we've heard that, which is reflective of how good a parenting group is for mums and the opportunity that we have for fathers. And then we move across to the fatherhood experience, and that is isolation, unfortunately, the increased risks of tragic outcomes. So these are the things that we believe are preventable. These are the experiences that we see generalizing, the experience across the board. And we also acknowledge that in this space, we're not just talking about mums and dads, but we talk about fathers and mothers in that kind of inclusive definition, which is, fathers and father figures and those who identify as fathers and father figures across the scope of the work that we do. The next slide is, I just wanted to highlight that there is kind of three domains in which we look towards doing our work. And that is that, I guess, we've aligned this towards how do we ensure we go forward supporting fathers in a way that meaningfully and importantly supports mothers and infants as well. So for us, our kind of litmus test is when we go forward with a program for dads, what are the impacts on mothers, and are they supportive, and what are the impacts on child? So this slide here helps us to just ensure the framing of our support, whether it's suicide prevention and men's health and wellness, or whether it's family violence prevention and women's safety and security and wellness, or whether it's childhood development and preventing negative childhood development outcomes. We're here to ensure that what we do in these spaces are progressing each part of this triad, or the father, the mother, and the infant. So that helps us stay in our lane in terms of family support, with a focus on fathers, which we think is quite relevant given the gap in the system support for fathers. We see the challenge in Australia, and more broadly speaking, as two key challenges, one being a system level challenge and the other being a cultural challenge. And we've seen the culture of fatherhood both positively and sometimes, as I was referring to more recently, some of the negative elements of that. We see these moving, and we also see the systems moving, but the rate at which the system is moving and the culture is moving is very different. So for us, it's about identifying how we can change the system levers to catch up with the culture of father inclusion, and how do we support a culture to move forward with a lens that's going to be helpful for mothers and infants, and not just become a men's health initiative at the cost of infants or women or the family. So that's something that we're passionate about, moving forward together. And for us, we're proud that we've gone slowly and intentionally with child health nurses and midwives um, and people who have helped us together co-design our approach, so that we're staying securely in that space around genuine family support that leaves a father feeling like there's been meaningful connection with them and also for their family. The next slide that we have here is just highlighting that the complexity of what we do is around an integrated model, and so that integrates or needs to integrate increasingly with policy, with existing government services, with the existing maternity care landscape, as well as research. We'll be hearing from Karen Winters as well on this call, which is really exciting. And also the organizational support. So your SMSs, your PAND, SMS for Dads, your Panda, your various types of organizations that actually support parents. What we do needs to integrate with those supports. So we're not duplicating or replicating service, but we're actually enhancing the existing service landscape. So that's quite complex, and we're 10 years in. We're excited for the work that we've done with a lot of the people who are on this call and many more, but we also see there's a long way to go. And the other exciting thing is the work that Karen will be speaking to later on will likely demonstrate that the need is probably becoming more and more aware from a government policy perspective, which is positive for us, and means that we can work towards a more integrated approach towards the programs that we're doing. The final slide that I wanted to share is just that I referred to the integrated model of care. And for us, this is intending to demonstrate that there is a journey and there's a map and there's I guess a user journey we're trying to integrate with across the life of a new mum and a new dad. And that starts at that pre-birth classes. It moves into a digital space with Dad Connect. It moves to often a maternal child health or a family child health home visit sometimes, and then back into a place where those child health nurses or midwifery group practice nurses will invite fathers into the service provision in the digital space. And then there's post-birth classes and then the ideal outcome, which is a community session where dads with their babies meet up and have a coffee, facilitated by a father with lived experience and education and supports to be able to provide to the dads. From there, there's leadership opportunities for our local groups, etc. And then in there, we kind of move back into the pre-birth classes. So it creates a nice circle, ideally, where there's fathers who are having a lived experience, they're having some support, they're moving through the system, and they're coming out the other side wanting to give back and encourage and mentor other new dads in that process. So that's a bit of the context of the integrated model of care and why we do what we do. We're going to hear also later from Karen, I think, and Sam around some of the how and also some of the why in the research space. But I just want to thank you for your time. We're really personally passionate about this work, and we're really grateful for your time and your investment in this space. For us, working with leaders like yourselves in your communities is what we would like to do more, and we're actively seeking opportunities to do that. So thank you very much, and I'll hand over back to you, Andrew.
Well done, Tom. Thank you for sharing. I think those visual representations really do hit home in terms of where we need to go, but also what's available right now. Thank you so much, Tom. Our next speaker is Dr. Karen Winter from Deakin University and also the Australian Fatherhood Research Consortium. And I first came across Karen when I was navigating this dad journey, and I kept seeing Dr. Karen's name pop up in terms of speaking at certain events and sharing research and opportunities to engage. So for me, Karen, you're someone who is really there writing this journey around supporting families and whole of family research, particularly this journey with Dad's Group and fathers and father figures. So thank you so much. So without further ado, here's Dr. Karen Winter.
Thank you, Andrew. And I think you just confirmed what I was going to say, which is I'm a researcher, which makes me a self-confessed nerd. I own it. That is me. I also need to, I'm in Victoria and the thunderstorm has just started, which means that my dog is about to go ballistic. So please forgive me. My dog doesn't handle thunder very well. I'm going to try and share my own slides, which I can't do. Tim, are you able to give me permission to share my slides? Otherwise, I'll ask you to do it. Okay, I'll try again. Okay, all good. Now, I'm guessing that's actually not showing you the right screen. Let me try again. There we go. All good. Can I have a thumbs up from Andrew or Blair? Yep, good. Okay, excellent. Thank you. Okay, so I want to also acknowledge the traditional lands and the owners, the traditional owners and custodians of the lands on which we meet across Australia, and pay my respects to elders past, present and emerging, and any Aboriginal and Torres Strait Islander people who may be joining us today. And I also want to acknowledge that First Nations people have been supporting and bringing together families on these lands for many, many thousands of years, and they have a community from which we can learn a lot. Okay. My brief was to tell you a little bit about the international evidence behind why we should engage fathers in our services. Tom has already given you a very good rationale for that. In my slides today, I haven't included the academic references, but if there are any that you particularly want me to provide, I'm very happy to do that. I'm going to make an argument that we should engage fathers for 5 different reasons. One is because it's good for mothers. One is because it's good for children. One is because it's good for fathers. Number 4 is because we're told to by the documents and the policies in Australia and internationally. And the 5th one is because we have the opportunity. Okay, so firstly, it's good for mothers. So we know that there's a significant association between the mental health of mothers and fathers. If mums are struggling, dads are more likely to be struggling as well. And if dads are struggling, then moms are more likely to be struggling as well. And we also know from Australian research that when women were asked who is their number one source of support during the perinatal period, they said their partners. Their partners are their number one source of support, and that's women with mental health problems and women without mental health problems. We need to think about how the partners can be that support for them if no one is supporting the father. That's the missing piece of evidence that we need to think about. There's also emerging evidence that mothers want fathers to be included in health services, that they don't see this as something that's an alternative to supporting them, but as part of, as what Tom said, supporting them. This is emerging research that has not been published yet from my colleague Vanessa Watkins, who's a midwife, and she's done surveys with over 1,000 women across Australia. And they've told her that there are 3 main reasons why they want to have partners and fathers to be included in health services in pregnancy and the postnatal period. One is to support them in their choices and decisions. One is to help them as a team understand what options they have and make decisions. and one is for them together to gain and share the understanding of whatever is being communicated in healthcare communications. And I can't give you the statistics because it's not published yet, but almost 100% of fathers told her in the survey that they want fathers to be supported in healthcare services so that they can support mothers, but also so that they can be supported in their own transition to becoming a father. There's a quote from another piece, and just talking about that, I feel like if he's there, then he understands and he can be more involved. Okay, another really good reason why it's important to include mothers. This is a report that's come from a study called 10 to Men, which is the Australian longitudinal study on men's health. It comes from the Australian Institute of Family Studies, AIFS, we call it. And if you need one piece of evidence to underlie including fathers, this is it. We know that poor paternal mental health is associated with using intimate partner violence. So they've done longitudinal study, which means they've surveyed the same fathers at various different points, and men who said they had depressive symptoms or suicidal thoughts in the one survey were 62% more likely to report having used intimate partner violence by the time the next survey came along. 62% more likely to say they've used it than men who didn't report depressive or suicidal thoughts. Now let's talk about babies and children. So this is a systematic review and meta-analysis, and all that means is it's a very high quality collection of evidence from across the world where they've pulled all the statistics together into a number crunching package, and it's spat out the evidence, and it says unequivocally that if fathers have perinatal mental health distress in the perinatal period, the children are much more likely to have poorer social, emotional, cognitive, language, physical development than children whose fathers did not have perinatal mental distress. This is a really important piece of evidence. And we also need to think about, for babies, there's an intergenerational effect. So if they have a good role model as a father, then they are more likely to thrive. And this is what we all want. We're all on the same page when it comes to what we need. Also from that report that I just mentioned, men who said that they had an affectionate father or father figure when they grew up were 48% less likely to ever use intimate partner violence compared to men who said they didn't. That's another very compelling piece of evidence. Okay, so we've talked about mothers and fathers, but let's just think about fathers. It's the right thing to do. It's the right thing to do to support fathers. Thomas told you a little about his journey and how isolated he was. He's not alone. I know Andrew and others on this call have had very similar experiences. During pregnancy and early parenthood, fathers are more vulnerable to depression, anxiety, and other mental health symptoms than at other life stages. You've heard the statistic 1 in 10 men. That's 1 in 10 men will have significant anxiety or depression during pregnancy or the first postnatal year. They also have poorer physical health than at other life stages, and this is something that's very much overlooked in the research. And what matters about this is it sets the pattern for what's to come. So if you don't catch this at this life stage, then fathers may continue to decline with their mental and physical health across time, but they also haven't had an experience where they have received help. So they are probably never going to go and seek help later. So that's another reason why we need to engage them. And I often hear midwives and family and child health nurses telling me, but they don't look for help. Fathers don't look for help. And yes, there are the traditional masculine norms, and fathers might believe that they need to be strong and all of that. There is an element of that. But the main reason why fathers don't look for help in this life stage is because they don't believe they are as deserving as their partners. Their partners need more help. They had the baby, and that is not untrue. But we need to encourage fathers to also seek help for themselves. And we know, and I'm sure you've all had experiences of this, and I'd love to hear about it at the end if there's time, where fathers tell you they feel ignored or overlooked during appointments when they come with their partners and infants. And I'll just show you a couple of beautiful quotes from some lovely research that we've got in Australia. Give you a moment to read that. In Queensland and in Victoria, we still talk about maternal and child health. The message there is immediately, Dad doesn't count. The rest of Australia, perhaps 2 steps ahead of us, where they're talking about family and child health or parent and child health. It's really tricky for fathers to get a message that they matter when they come to a building that says family and child, maternal and child health. See, Andrew's just left his screen because the storm is coming. It tells them I'm not really part of this parenting team and my role as a father is not important. Okay, now I'm getting to this. You all know this. You might recognize this document. This is the National Action Plan for the Health of Children and Young People. It has a beautiful first page with some priorities, 5 priorities. One of those 5 priorities is empowering parents to maximize healthy development of children. And part of that is increasing opportunities to support fathers. And it's in the document. Unfortunately, there's no money that has come with it yet, but it's in the document telling us that we should be doing this. Same for the National Framework for Universal Child and Family Health Services. Although this document is 15 years old, it's calling for father inclusive practice, and it's pointing to a document that Richard Fletcher, who you will all have heard of, I'm sure at some point, prepared all that time ago, 15 years ago, about father inclusive practice. Still, these are the things we're advocating for. And of course, the National Men's Health Strategy also calls for including fathers in the perinatal health infrastructure, and so does the World Health Organization. So the documents are telling us to do it. No one's given us extra resources at this point, but it feels like we need to be trying to do what we can, even without those extra resources. My final argument is about we have the opportunity. This is a golden opportunity because you often have a father or a partner sitting in front of you with the woman or with the woman and baby. We call this a gateway opportunity. It's not an opportunity that we're necessarily going to have at any other life stage for that father. So it's one that we should grab. And yes, it's true, we don't have referral pathways all sorted. We don't have an instrument that measures and screens fathers like we have one that screens mothers. Those things are all true, but they shouldn't stop us from checking in with dads. I think it's really important that we check in with dads, even if it's to say, look, I see you're experiencing some difficulties. Please go and see your GP. I mean, that's embarrassingly short-sighted to have to do that, but it's better than nothing. So let's use those opportunities where we have fathers in front of us. They want to be included and involved. They've told us that time and again. And at this life stage where they're rethinking their identity and their role, they are often open to address any mental health symptoms they might have or any behaviors or attitudes that are not healthy towards the partner or the baby for the sake of the baby. So here's another lovely quote from Australia saying, if I get help for myself, it's helping the baby. I think that's it from me. I just want to say, if you want to hear more about the evidence, every year we hold a fatherhood research symposium in Melbourne and online. The team will circulate these links to you, but it's like a warm hug being there. Tom will attest to that, and Blair and others who've been there. It's an absolutely beautiful forum for an update of all the latest work that's happening in fatherhood space in Australia. Thank you. Stop.
Thank you, Karen. The research is pretty compelling. You could tell that all the signs are pointing to support fathers and why it's so good for communities and families and the broader community. So thank you so much. Our next speaker is Sam Cook, who is the maternal health coordinator for the city of Stonington. And Sam has been a superstar in this space, particularly supporting fathers and particularly obviously in Stonington. But we've had a partnership in terms of Dad Group over many years, supporting the whole family unit. So much experience, so much great knowledge to share. Again, from my experience, has been someone who's been ever present in the Stonington space with all of the Dad's Group events, and someone who really is a big support to a lot of families across not just Stonington, but I think a lot of you here will probably nod your heads. She's a wonderful in the space. So, Sam, over to you.
You just unmute, Sam. You unmuted yourself, then you muted yourself again.
Am I unmuted?
Yeah, that's
Oh,
it.
thanks, Karen. I can see very unusual for me to not be my voice. Thank you. I would like to acknowledge the traditional owners of all of the lands that we're meeting from today and pay my respects to their elders past and present. I'd also like to acknowledge the great work that Dad's Group have done here in Stonington, as well as across, they're an amazing group to work with, and they are very passionate, and they're just they really want to help each other out. And I just think, why we've got this opportunity and we've got an organisation that are so passionate that we can all join together rather than trying to do this on our own. So I'm really grateful for the work that you guys have all done. And I was just going to talk to you today about father inclusive practice and making it seamless in child and family and community health services. Each of the photos I just want to acknowledge that are here today is from one of our new parent groups or one of our events that's included dads. And so it's real, and they are the people that have made this happen here at Stonington. So next slide. Thank you. So I guess, how did we do it? How do we do it? And for us, it's about engaging partners and families early. The early touch points are our strongest opportunity. Our home visits and the early weeks are when dads are present. They're curious and they're very receptive. So it's a great opportunity then to engage early and to increase attendance at new parent group. The first home visit, we talk about the new parent group and we invite all parents. The CAS consultations, we also invite all parents to those. When we send out information, we send it out to both parents, so not just one. At the moment on our CEDA system, there is a primary carer option, which we hope to see change when we get our new system so that all parents get the information. That's correct, Karen. A CAS visit is a key age and stage consultation. And for those of you who are not in Victoria, we do 10 of them across the early period from birth to school age, and they are set at different ages. Even when dads are in the session, just the small acknowledgements, the eye contact, the direct questioning for dads and open and meaningful conversations, that doesn't need anything different to what we would do at a normal consultation. It's about maximising the opportunities that we already have. This picture here is of one of our favourite dads group members, and also Matt, who we had a session earlier this year on and showed the movie Scene, and it was a great opportunity for Dad's group to join us together and put that on. Just next slide. There may be some concerns about, what do we do when there's someone else in the room at a consultation, when there's a dad in the room? How do we ask the MARAM questions, which is the multi-agency risk assessment and management and maternal and child health, child protection? This questioning is asked by a lot of services in Victoria, and that's about making sure that it is not something that people think, oh, why are you asking me this? But everyone asking the same questions to the same people. But if there is another person in the house or there's someone in the office, we don't ask the MARAM questions. We have created a flowchart as a team as to what to do, and that is after the consultation, we may do a phone call, just stress to the mother that, there was parts of the conversation or the consultation that we didn't have. Do they have time to do it now? Are they with anyone? Or we wait until the following consultation. But the biggest thing is that we make sure that we document why the MARAM questions weren't asked. I'm also happy to share our flow chart if anyone would like to see it. It's fairly simple. It says, did you ask the MARAM questions, yes or no? And then it follows on from that. So I'm happy to share that. Next slide, thank you. So what have we done? We've gone from being reactive to routine. Why does that matter? So fathers linked proactively to peer support groups report reduced mental health strain and improve family dynamics. Co-facilitated just since July last year 37 sessions with the new parent group, and we ensured that dads felt seen and included right from the start. And that means that it's about 300 dads have attended during this time. As part of this, there's a WhatsApp group that Dad's group creates. So maternal and child health, child and family health services, we don't have to do that. Dad's group do that. There's weekly Saturday gatherings that have evolved naturally from early proactive contact here at Stonington. And to my knowledge, the one at Malvern East has been around for many, many years, more than 10 years. And what we did was we reignited that, and we also got a group over on the other side of town so that location was all right, and then we brought them together. So again, it's just simply making space for dads in conversations that we already have and not an extra program. Next question. This is actually a photo of one of the dads group sessions at our centre. We have changed our new parent group sessions and the content, and I might even talk about that later. But the first thing we did was we changed the time. So rather than having a new parent group at 10 o'clock in the morning, we start the dad session at 4 o'clock and dad's group come in at 5 o'clock so that people can join us in the afternoon and go till 6. We have also trialled in the past evening sessions where we've had lots of dads come to those as well. And it was more about try a whole heap of things and see what works. And so that's what we've done. And we keep looking at how we can improve our services and what we can do. One of the big things is that simple phrases that make a big difference. And some examples of this from my team are, we'd love to have you join us. Dads tell us it really helps. There's a local dads group. It's relaxed and you're welcome anytime. And lots of dads feel unsure. How's the transition been for you? So sort of open questions, inclusive questions, and letting dads share their information and their thoughts, because often they are sort of sat in the corner or over the other side on the uncomfortable chair that we've pulled in from another spot because we only have one chair in the office. We've changed all of that as well. So there's, more comfortable chairs and everyone can sit down and, be part of our consultations. Next question, slide, sorry. This is a picture of our man with a pram from last year, and we've tried to use inclusive approaches for diverse communities. We ask open, culturally sensitive questions. Who plays what roles at home? We allow for different expressions of fatherhood. Some dads listen first, others dive into sharing, and they're more than happy to share information. But some of them want to sit back and, just wait until they're happy to share information. So Man with a Pram was a great opportunity for dads to get together and talk. It was a beautiful day last year and they all wandered around, and not only was it good for the dads, but the community. A lot of people come up to us and said, what's going on here? And so we were able to share that day with people that would never have known. And I got a lot of, oh, gee, I wish that was around when my kids was little. My husband would have loved that. And so it was really, really acknowledging and great for people to acknowledge that we are doing something different. And, this is great for people from all different cultures. We met together, we walked around the park and had great cups of coffee and just spent time together with parents. Next slide. So that's another one of our sessions where dads were there and just, all of them, they look gorgeous just holding their babies, and you can see, the love that they have for each other and their children in these sessions. So other things that we've done is Saturdays, the Saturday group, and we've also got Saturday maternal and child health appointments now so that families who do work and who want both parents to come can come along on a Saturday appointment. Then from the WhatsApp group, fathers have reported feeling more supported and being more confident. From the new parent group transformation, as I said before, we've adjusted the timing. There's father-focused content and co-facilitators from Dad's group. So we've had much higher father participation, stronger connections, and more confident families. And that was just another thought about Man with a Pram. So these are examples of just small shifts, not new programs as such, other than the partnership we've created with Dad's group, but the outcomes have been amazing. So just the next slide. Yeah, and so here again are the outcomes. I have mentioned most of those. The other thing, just when Karen was talking about the Fatherhood Research Symposium, we've spoken about this at the Fatherhood Symposium. So it's great to be able to share these wins when we do them, and to look at the research such as what Karen presented earlier and think, right, we have been able to be part of this. And what I've found is We can't wait for it to be legislated. We can't wait for it to be funded. We just have to get in there and do it the best that we can. And so, that's where we have been able to do that with Dad's group. So I guess my core message is it's not extra work. It's a natural extension of what child and family health already does well. It strengthens families and improves outcomes and builds community. And when dads are supported, everyone benefits. Next slide. Next slide. So can you go one more? Yeah, beautiful. How can we include Dad's group in child and family services? It's about funding and money. And there's often a local government community grants, which is where we've sourced some funding for our model. Changing the format of New Parents Group to include information that includes dads and stats and supports, that doesn't cost anything. And encouraging and being inviting for all parents to come, again, there's no cost to that. The meetups for dads and children on the weekend doesn't cost us anything as a maternal and child health service, but we can promote it by our services. Federal and state government funding that supports community, family, perinatal and family violence support could also be used to get this off the ground. Local government grants or funding from other services. So we all have to have a health and wellbeing plan. Maybe there's some funding there, the social policy and community development funding. If you can go and talk to your colleagues in council and local government and share these ideas, I think they would love to hear about it. Our team certainly has, and we work very closely with other departments in our council. I guess going back to, why I'm so passionate about this, the next slide, yeah, it's actually my aspiration to hear dads share that they met at Dad's group, they met at New Parents Group, or they met at the Maternal and Child Health Centre. For many years, as Tom said, I've heard people go, oh yeah, we met at Mum's group. We're having our kids' 21st birthdays. And it's always the mums that turn up and the dads may or may not come, but I want to hear the dads say that. I want them to say, oh yeah, we met 21 years ago and, it was at Dad's group or a Saturday down at, Phoenix Park or Central Park. And that's really my hope. And I can't wait till I hear that at least once. And I'd like to leave you with these quotes from our nurses and the dads who have attended our sessions. One of my maternal and child health nurses, child and family health nurses, said, I was so full of dread before doing this evening dad session, but it was one of the most rewarding things I have done as a maternal and child health nurse. Alex D from Dad's group was wonderful. It was amazing. And then one of the dads said, getting to know other dads in the community and sharing experiences, positive and negative, which provides immense perspective. It has also improved my at-home family dynamic by enabling my partner, to have time to herself. It has strengthened the bond between my son and I. And that was from a dad. Another one of our nurses said, working together with Dad's group and the group leaders is the new parents in the New Parents Group session has been amazing, and it's been made such a difference for the work we do. The group leaders engage so well with the new dads and they just absolutely love it. And then just to finish off, one of the dads said, it's the first time I've been asked how I'm doing by someone who actually wanted to know. So I think, if we can look at what we do, and the little things that we can change and influence, I think it makes so much difference. And you'll actually, like, the feeling that it gives you to be able to provide that service is just amazing. And, I truly hope that we can work together towards confident and connected families. That's me.
Thank you, Sam. Well, I have to smile because I can tell you that I met my current group of dad mates at Dad's group at that very centre, and it's just a fantastic story. So thank you so much for sharing. We've got about 10 to 12 minutes left. So what I'd like to do is you've got the option to put in chat, or you could sort of raise your hand and we can take you off mute. So this is really for all the panelists that you've heard today. Do you have any questions? Is there something that you want to ask? So I've got Tom, Karen, and Sam. So if you'd like to, feel free to take yourself off mute, or if you want to put something in chat, we can get to those as well. Sorry, Fiona, audio is pretty static. Do you want to maybe try one more time, or we can sort of try in the chat? Yeah, we try again.
Just wanting to know all groups on the NCH nurse, and they're all co-facilitated for the NCH nurse. And the dads, or is it a bit of a mix?
So I think the question was, are the catch-ups co-facilitated with the dad's group facilitators, or is there a mix? Is that right, Fiona? Just give me a thumbs up. Yeah.
The Saturday sessions are solely run by Dad's group and dads of the community. The maternal and child health nurses don't attend those. So, it's not another added thing for us to do, but we actually do, like, how we support that is to let people know about it and encourage dads to attend.
Liv asks, hi Sam, how often do you run the dads group from 4 to 6 p.m? Are they weekly?
So the dads group session, we run 6 sessions for the new parent group across 5 maternal and child health centres. So they all run their own maternal and child health new parent group sessions, and dads group attend one of those. So it could be 2 or 3 times a week that in different locations that dads group are attending that session.
Maybe one for Tom, although I do know some of the answer to this. Peter asks, are there dads groups in different areas of Melbourne?
Thanks, Peter, and thanks, Andrew. Yeah, there are different dads groups across our Melbourne. Even David Hawkins is on the call, I know, and he runs Dads of Casey and a number of different amazing programs down there. And what you'll actually find is different councils who have invested their time and effort and resource into dads groups will have different versions of different things. We work with a number of different councils across Victoria and Queensland and South Australia, etc. And the ones that come to mind are in Stonington, obviously, in Marybeck, Brimbank, City of Casey, as mentioned before, and there's a few other ones across Melbourne. Happy to send you through a list, Peter, or get our team to send you through a list of where the ones that are affiliated with us are. But also just to note, we're wanting to catalyze and move towards more of a capacity building organization. Our goal isn't to try and run more of our own, but to catalyze more dads groups across the state and also nationally. So yeah, really keen to help you where we can for you to establish your own. Our intention for the ones that we seek funding for and run and facilitate is to demonstrate that the model works and how it works and evaluate how it works. But the way forward for the future is really capacity building in the communities that we work with and allowing them to own their own dads groups, own their own father inclusive programs in a way that really fits the local community.
Would anyone else like to take themselves off mute, or you can chat? We've got time for maybe 1 or 2 more questions.
Andrew, can I just mention, I
Yes.
was actually up in Mildura recently and sitting down the river having coffee, and Dad's group rocked up and they all went for a walk, and I was so proud. I thought, oh my God, it's made it all the way up to Mildura. So yeah, that was pretty special.
Anyone does? Hold on, we've got one. Susan, Manningham and Maroondah, yes, are running dads group with Relationships Australia. Is anything you wanted to add to that, Tom? At all in terms of
No, that's great. That's exactly the idea, is that we're able to, and we've worked with RA in the past as well with Dom Alford and his teams around building capacity in local councils and communities where we can. We encourage maternal child health and child health experts and practitioners to apply for funding. And, as referred to before at the very start, we're happy to work with anyone wanting to seek funding in that space and apply for funding. That's what we've done with various different councils in the past, which have had quite a bit of success. But really that collaborative partnership when council is on board with you, and you even have often the mayor or the councillors actually attend events. These are the things that really change that cultural piece as well as the system piece. So exciting to see more of this, and hopefully we'll be able to catalyse more of those types of groups in the future.
Thanks, Tom. And just maybe one more before we wrap up. We've got a couple of things for you all on the call today. One, we have a survey. Would love your feedback on the discussion today. So I know Blair's going to pop it in the chat. The other one is, if you want to learn more about what we've discussed today, whether it's how to get more funding for your area, maybe it's just to pick Sam's brain and understand the model and how successful it was, or maybe you're more interested in Dad's group and how that model could potentially continue on the great work that you're doing. We do have a session Wednesday next week, so Wednesday the 1st of April at 11:30 Victoria time, where we'll be sort of going through, bringing you questions about how to ask for funding, how does it work, our sort of shared experiences, whether we can help bring together that community of practice we sort of talked about at the top, which is really what today is about. It's bring together all the knowledge and the experience and the learnings from everyone in this room and how we can sort of make an impact forward. So thank you. You'll see that link there. Thank you, Jem. There's a registration link there. And there's also the survey there. You can have a QR code. Maybe just one final one from me. What do you think the future of health, fatherhood and family health looks like? Maybe a quick sort of 30-second around the room. Maybe Tom, do you want me I'll start with you. What does that future look like for you? What are you excited about?
I'm excited to see that the culture is really starting to bang on the door of the system. And I think what we're seeing there is mums and dads and professionals are actually uniting under just like really simplifying the message, which dads should be included. It's good for mums, as Karen said so beautifully. It's good for babies. That's what the research says. It's quite a simple ask. And each year we get further and further away from where it should be, and more data to substantiate what we're asking for. So I see a future where things are moving. We're hearing that from ministers like Jed Carney, the federal level, and state ministers across different states. They're starting to realise that soon there will be a situation where you build a car in the 60s without a seatbelt, but you don't. And that's not negligent, but you wouldn't build a car without a seatbelt now. And I think we're in a situation where that analogy is quite relevant. If you're doing family support in the maternity space without including fathers, you're actually sending mums and infants into a place where there's preventable risk.
Thanks, Tom. Karen, what are you excited about in the future?
I think what I've seen in the last decade or so is that, the researchers are doing their research and coming up with what we need to do. And we keep talking about the barriers. But then we've got the Sams of this world and the Dave Hawkins of this world who are saying, well, stuff that I'm going to take the resources I have and I'm going to make things happen. And I see us coming together in the middle, and I see that as a really beautiful moment and one that's long overdue.
Oh, what a wonderful sentiment that is. Thank you, Karen. Sam, what are you excited about?
I am excited about being able to be inclusive of all parents and having people like who we have on the meeting today there to support us, having the research to take with us and say, look, here it is. We need to change our system. We need to change our service. And this is all that it's going to take. It's not something that's too hard that we just can't do it. It is here. It is these small things that we can do. It's the training and the guidance that we give our maternal and child health nurses or our staff and our people that work with to say, here are the resources. This is what we have to do. And I was almost about to say this is all we have to do, because I can't see it. I see it as not that hard to change. It's about how we change, but we are very inclusive of everyone. And then you see the benefits, like, the photos that we show, the smiles on the dad's faces, the fact that, mums go, no, Dad can go and change the nappy. I don't have to do that. And I have no problem with it, and being able to parent together. That's what I can't wait to see.
Thank you, Sam. So lastly, just thank you to all our speakers, Tom Docking, Karen Winter, Sam Cook. What a great session it was. As I say, if you're interested, please, continuing the discussion, please register for that on the Zoom link for next week. We will send out some follow-up resources and some links again for those who attended. So yeah, thanks everyone again for attending. We'll look forward to seeing you all soon.